Welcome to this presentation. Today our discussion will be on COVID-19 concerns and perceptions. Before going into our discussion, I'd like to say a special thank you to Dr. Sandra Robinson Madden, Senior Lecturer and Research Director at Montego Bay Community College, who was kind enough to have invited us to do this presentation as a part of their research day, which is entitled Aligning Research with Industry Needs for Growth and Sustainability. Now, in looking at the topic, we all must admit that the word research has been very loosely used nowadays, especially as it concerns COVID. So what I'd like to do is to just briefly say what research is not. From a scientific perspective, and certainly from a medical perspective with respect to COVID, research does not mean forwarding YouTube videos and Facebook videos. It does not mean following opinion leaders on social media. It does not mean repeating social media talking points. And it certainly does not involve Googling articles that are not peer-reviewed by experts in the field. That, unfortunately, is not research, but with respect to COVID, there are many people who consider this to be solid research. For the research students amongst us, I'm sure that Dr. Robinson Madden would insist on credible sources that are experts in the area that you're researching. My role today, therefore, is to act as a source. I will therefore provide my expertise as a healthcare professional with a requisite medical training and over 20 years of clinical practice. I'd provide brief and clear answers to many of the issues of concern with respect to COVID-19. So let's get to the topic at hand, COVID-19, concerns and perceptions. I'm Dr. Shaun Jones, Clinical Director at Trinity Mall Medical Center. Welcome to our presentation. Now, the first question that was asked early out during this pandemic is COVID-19 real? Now, to answer this question, we have to accept that there is a group of viruses called coronaviruses, and they're referred to as coronaviruses because when scientists look at them through a microscope, they actually look like a crown, and the word corona is a Latin word for crown, so they are referred to as crown viruses because they are shaped like a crown. Now, these viruses were identified previously in the case of SARS, which stands for Severe Acute Respiratory Syndrome. That outbreak occurred in Asia in 2002 to 2004. We also had a second coronavirus that was identified, which was MERS, which is Middle East Respiratory Syndrome, and that breakout occurred in 2012 to 2014. In 2019, another coronavirus was discovered. This one was pretty new and was referred to as the novel coronavirus. There was no real name for it, so coronavirus disease, which was discovered in 2019, was shortened to COVID-19, where the COVID stands for coronavirus disease, and the 19 pretty much refers to the year that it was discovered. Now, since that discovery, 5 million people have died across the world from COVID-19. There are 5 million reasons to understand and to believe that COVID-19 is real. The other question that is asked is COVID-19 a conspiracy? Now, if we're to think of COVID-19 as a conspiracy, we have to therefore believe that all leaders of the world and their cabinets would have agreed to this conspiracy. Now, the fact is, as you and I know, most countries can't get their own parliament to agree on internal national matters, let alone a global conspiracy. And for this global conspiracy, it would mean that our leaders of these countries would have been agreeing to harm their people, to disrupt their economies, to set back their educational levels by many, many years, and to reverse all the economic gains they have made over the last 10 years. I think that if we should reasonably consider these things, I think we would all agree that COVID-19 cannot be a global conspiracy involving all the leaders across the world. That is not the case. This is a real virus that is harming families, that is harming individuals, that is harming communities, that is harming businesses, that is harming entire economies, entire countries. It is real. It is not a conspiracy. Nobody wants this. Everyone is trying to fight against this. Now a question has been asked, can my natural immunity protect me from COVID-19? Now, first of all, the term natural immunity is being misused. To have natural immunity, you must get COVID. So here are the facts, and let me repeat it. To have natural immunity, it means you have to contract COVID-19. That is what natural immunity means. It is incorrect for people to be told that they can take vitamins to develop natural immunity against COVID. Natural immunity means you have to be exposed to the disease that you have become immune to. That's what immunity means. Immunity refers to a specific defense mechanism that you have to a particular pathogen. And when we say pathogen, we mean a bad thing that is affecting the body, whether it is a virus or a bacteria or otherwise. But you have to have a specific immune response to that particular pathogen for you to say that you have immunity. Now, the other way to get natural immunity is by vaccination. That's the only other way to get active immunity, what we refer to as active immunity. Now, there's another type of immunity called passive immunity, which can be passed on from a vaccinated mother or an infected mother to her unborn child. The fact is, none of us are in that position where our mothers would now be passing on anything to us related to COVID-19. So it means, therefore, that natural immunity is not necessarily your best choice, because natural immunity means contracting COVID. Contracting COVID puts you at risk of death. So that is not acceptable from a scientific perspective. Should I stay home and quarantine if I get infected with COVID-19? Absolutely, you should. But before just staying home and quarantining, it is very important that you see a physician. You must see a doctor because you must be treated. You can be treated to prevent a lot of the symptoms and also to decrease the severity of the disease so that you are less likely to end up in the hospital, right? The only other way to prevent, to mitigate against being admitted to the hospital is to become vaccinated. But that's a discussion we'll have a little bit later on based on the questions that people have asked. The other question is, can I catch COVID-19 more than once? Yes, you can. You absolutely can. So in getting COVID, if you get the COVID infection, that does not mean that you're protected against it for life. As a matter of fact, after getting the COVID infection, you have pretty good protection for approximately 3 months, after which it is more likely that you can contract the disease a second time, all right, or even a third time. So please be aware of that. Catching COVID does not protect you from getting COVID in the future. Now, the next question asks is, how long after getting COVID-19 should I wait to get vaccinated? Well, initially you might have heard guidance that related to 3 months. And the reason we had put that guidance out for 3 months was pretty simple from a public health perspective. And what I mean by that is, for someone who has gotten COVID, they have protection for about 3 months. So therefore, in the case of a vaccine shortage, as it was in the initial stages, and even so for now, in the case of vaccine shortages, then because someone who has contracted COVID is partially protected, then what you'd want to do is to use your vaccines for other members of the population who are not yet protected. For example, people who have not had an infection and people who are unvaccinated. So that is why we had a 3-month guidance. But essentially, if you have had COVID and all your symptoms are now gone, you are good to go to get your vaccination. So as soon as the symptoms are gone, you can become vaccinated against COVID-19. Now, another question is asked, a most important one: what is in the COVID-19 vaccines? Now, there are 2 types of vaccines. There are the mRNA vaccines, which are the newer types, as seen in Pfizer and Moderna, and you have the more traditional vaccines, as in the AstraZeneca vaccine. Now, the mRNA vaccines use a protein that is usually found in the body, in every cell that's in the body. And that protein, you could describe it as like, in Jamaican parlance, you could consider that an informer protein, meaning anything that comes into the community. So let's say this protein is a part of a neighborhood watch. And anything that comes into the community, this protein takes a picture of that thing and takes it to the police station and say, hey, here's a new guy who is here, right? And a process starts for the police then searching for that new guy. So what was done with these newer vaccines is that the mRNA was actually equipped with the spike proteins that are found on COVID. Now, the reason this was done is that the scientists considered COVID as being far too dangerous for us to actually use the entire virus to create a vaccine, as is done in most traditional vaccines of the past. Because at the end of the day, this was a new thing that was happening. It was seen as being as pretty dangerous. A lot of people were dying. As scientists, we wouldn't have wanted to take the chance of actually using the entire virus based on the sort of effect that it has had on folks. The more traditional vaccines, like the AstraZeneca vaccine, actually use the spike protein embedded in a killed virus that we usually use in other flu vaccines. So that's the difference. AstraZeneca does not use the mRNA technology, but uses a more traditional technology combined with the spike proteins, while the Pfizer and Moderna use the mRNA technology. Now, a consideration, of course, and we've heard this, so I'll just speak to it, is that many people are saying that because of the newness of the Pfizer and Moderna vaccines, because of this new vaccine technology, people are saying, therefore, that, you shouldn't use that because that's not a vaccine, etc. And honestly, when you look at scientific progress as we have made over the years, that is similar to saying that we shouldn't have used an iPhone because it is so advanced, so it is not a phone. That is pretty much what would be said about the Pfizer and Moderna vaccine. So the question you have to ask yourself is, was the iPhone a phone, and was it a good thing for us? It is here to show us that it was good for us, right? How was the COVID vaccine developed so quickly? Many people have been asking that, and that has fueled a lot of conspiracy theories, right? There are two reasons for that: money and cooperation. It's as simple as that. Money was thrown at COVID-19 because every country in the world wanted to solve this problem, because this is the biggest problem we have seen across the world in 100 years. The last time something similar to this happened was in 1918 during the Spanish flu. And for world leaders to see that repeating itself, you can imagine that that is where the cooperation came in, where all hands were on deck. All medical researchers, everyone across all countries were doing research all at the same time. Now, how did the cooperation help? Well, let me give you a little bit of insight as to how research usually happens in medicine. Let's say, for example, Pfizer is developing a medication and they need to test it. What they would do is they would get a group of people in the United States, let's say about 5,000 people. They run their trials on those 5,000 people. When they have gotten information on those 5,000 people, they submit that information and then do a new population. So let's say they would now go to the UK to get another 5,000 people, etc., etc. So as you see, this would be a very time-intensive process, because you have to do one group, then move to the next group, do what you're doing with this second group, then move to the third group, etc. And during all this time, for each time you get some success, you would then have to be applying for funding, etc. Now, with COVID-19, all of that changed, because countries across the world had research teams working in tandem. So whereas, for example, we would have typical research groups that would be measuring between 1,000 and 5,000 people, for COVID-19 groups in many countries simultaneously, you had 45 to 100,000 volunteers doing COVID-19 research all at the same time, and all being funded through private entities that were concerned, through governments that were concerned, etc. So that is what happened, guys. It was no conspiracy as to why it came about so quickly. The fact is, money was thrown at it, expertise was thrown at it, and the world cooperated. On top of that, recall we had mentioned that there was the MERS that was first, that had an outbreak in 2012 to 2014. Work was being done on a vaccine at that time, but because the folks in Asia have always done very well with respect to masking and stuff like that, MERS was put under control, so there was no real need to do further development with this vaccine. However, with the advent of COVID-19 and the needs and the urgency that was presented, then this technology was revisited and was seen as the best and most suitable option to get us out of the problems that we're having with COVID-19. So that is the reason the vaccine was developed so quickly. Now, people have been very concerned about side effects of the vaccine. So the question asked here is, will the COVID-19 vaccine harm me with the side effects? Now, here's what we all should recall, and the children will remind us. We've all been vaccinated, and if you ask your mother, and for those of us who are old enough and who have kids who we have taken to be vaccinated, we recall or we know that after vaccinating the baby, we have Panadol at home that we're going to give the baby for a very simple reason. It's likely that the baby will be in pain and the baby will be having fevers. Ladies and gentlemen, this is how vaccines work. The vaccine causes a reaction throughout your body to build your immunity. During the time that reaction is taking place, you can have some side effects. Now, what you need to bear in mind is that your vaccine is mimicking the disease, and therefore the side effects that you get from taking the vaccine would probably be 1/10 to 1/100th of what would happen if you actually get the disease. So the question we really need to ask ourselves is this: if we are concerned about the side effects of getting vaccinated, what then is our concern for what will happen if we actually get COVID? And what would we really prefer? Would we prefer to be alive to deal with side effects, or would we prefer it otherwise? Because getting COVID, we're at a high risk of death. So while there are side effects, these are side effects that the scientific community, through all the research and all the testing that has been done on the vaccines before they were brought to the public, we see that the side effects are well worth the risk of taking the vaccine, because the vaccines protect you from future infection and the vaccines save lives. Now, the next question here is, do I need to do a COVID test before taking the COVID-19 vaccine? No, you do not. There's absolutely no reason to do a test before taking the vaccine. If you're not having any symptoms, then go right ahead and take your vaccine. The next question is, should I take the vaccine if I have a medical condition? Well, there are very few medical conditions that would prevent someone from taking this vaccine. And quite frankly, the medical conditions that people might be most concerned about, for example, high blood pressure, diabetes, etc., it is these conditions and the folks with these conditions who we want to get their vaccines as quickly as possible. And the reason for that is that people with these conditions are at a higher risk of death if they contract COVID-19. Getting vaccinated protects them from this risk, and it is so much less likely for them to die from getting COVID-19. As you all have seen, and if you should check the statistics with proper research, and when I say proper research, simply calling MOH, the Ministry of Health, we could look at the number of vaccinated individuals who have been admitted and who have died in our hospitals as compared to the unvaccinated individuals who are dying in our hospitals. There's absolutely no comparison. Unvaccinated individuals in our hospitals are dying instead of the vaccinated folks, because the vaccinated individuals are not ending up in the hospital. Can I catch COVID after getting vaccinated? The answer to that is yes. But let us understand what we mean by that. There's a misunderstanding of what vaccination is. Now, as you recall, and if you think of the process, the vaccination involves you getting an injection, and there's something that goes inside your body. So bear in mind the fact that when you're vaccinated, that does not mean that there's a force field that surrounds you that prevents COVID from entering your system. Now, that is the reason you get vaccinated, because when our masks, which we refer to as the barriers, so your barrier defenses, your mask and the sanitization and so on. You're protecting. So for example, sanitizing your hands, you're protecting your borders by getting rid of COVID before it could even reach to your nasal passage, etc. Wearing your mask, you're blocking COVID from coming into your nasal passage, right? But what if without your mask, someone has sneezed close to you or something like that, and so your external defenses, your barrier defenses are breached? It means then that COVID has now gotten inside. You have now gotten an infection of COVID-19. That's the fact. That is where the vaccine comes in. So please remember that your vaccine is not going to protect you until you get an infection. And now, how does it protect you? When you get that infection, because you now have immunity to COVID, cells in your body now rush to the area, fight off COVID so that you don't get sick and so that COVID doesn't remain in your body for any extended period of time. So absolutely you can get an infection after getting vaccinated. But your infection is not going to last any time, and you probably won't even realize that you have gotten an infection because you likely will not get ill, right? For those people who have gotten ill, certainly what I can share with you from my experience in my office is for unvaccinated individuals who come into the office and who we diagnose by testing, by doing antigen testing. When we repeat their testing, sometimes 14 days after, we still find viruses in the system, and therefore we still require them to quarantine for a little bit longer before going out to work until we can get a negative test. For the vaccinated persons, the very few that we have seen in office who have had symptoms and have been concerned, and we have done the test and found them to be positive, repeating that test within 5 to 6 days shows that they are negative for the virus. So that should tell you exactly how the vaccines benefit, because for one, those people who are vaccinated, even if they get ill with an infection, this illness or the infection does not last as long as for those persons who are unvaccinated. So it means therefore that the likelihood of somebody who is vaccinated transmitting the virus to others is way less than for an unvaccinated person. Interestingly, the next question is, are vaccinated people the ones spreading the virus? And as you heard from my explanation just now, no, that is not the case. Vaccinated persons are not the ones spreading the virus. People misunderstood that because there was one point when one of our healthcare leaders had mentioned the fact that people who are vaccinated would likely be asymptomatic. And that is what I just described. The fact that, because the vaccine is fighting off the virus, you probably wouldn't even know that you're ill. And that would mean, therefore, that such a person might likely interact with their families and not realize that they have the virus. But the same is also true for someone who is unvaccinated. And as we have established, the unvaccinated person would have been spreading that virus for 14 days or possibly more. While for somebody who is vaccinated, that would likely be only 5 days. So that's the difference that you see. So there's no way that we could reasonably say that the vaccinated people are the ones who are spreading the virus. Now, here's a very important question that a lot of people have been confused about, and not just confused. People have hinged their decision on this because there's been so much talk about this on social media. And the question is, why should we take the vaccine when you can still get infected? Right? I know that you all have heard my explanation as to how the vaccines help and the fact that people still get infected, and that's when the vaccine actually works. The vaccine works when you get infected. But this social media talking point, the way to look at it very simply is think of yourself living in one of our any regular community or a volatile community, or any community that's preyed on by thieves, right? So let's just picture that. You have your yard, you have a fence around your yard. Your fence is pretty short. It's not a high fence. We can't afford any high fence. It's pretty short and somebody can jump it, right? So thieves come through the area at nights, and you notice that, they have been jumping the fences of your neighbors and stealing their things and so on. Now, if we're going to subscribe to the notion that we shouldn't take the vaccine because we can still get infected, then that is similar to saying that we have the short fence, but we shouldn't put any dogs in our yard that could protect us from the thieves, because the thieves can jump the fence. Now, if you look at it and if you look at the logic behind that, I mean, if we have dogs in the yard, when the thieves jump the fence, the dogs will take care of them before they reach to our house to steal our things. Isn't that so? I'm sure you agree that that is the case. So why not have the dogs in the yard even though our fence is low? Because guess what? We don't have a choice. We can't raise our fence. We cannot afford to raise our fence. The fence stays at that level, so the thief will be able to jump the fence. But at least if we have the dogs inside, it is way less likely that they can steal from us. It's a similar scenario with respect to getting vaccinated. So please don't subscribe to the notion that we shouldn't get vaccinated because it's not protecting you and you still are going to get infection. That is absolutely not the case. And that's just the wrong way to look at it. Now, the big question that faces industry is, should workplaces mandate the COVID-19 vaccine? And while that seems to be a big question, from a public health perspective, if you really look at it, if you look at the data, look at what is happening around us, there are a lot of families that have been affected. There's a lot of pain, there's a lot of death, and all of this is related to folks who are unvaccinated. So the truth is, for any workplace that is looking to maintain their staff, the health of their staff, then it is quite reasonable for these workplaces to mandate vaccination. And the reason that would be required from a medical perspective, because I speak not from the politics of what a workplace should do, but what is necessary for us to get out of this pandemic. It is important that we all get vaccinated, because if we don't get vaccinated, more people will be at risk, more people will die, and COVID will continue to be with us if we all don't get vaccinated. So indeed, I think that workplaces ought to have a vaccine mandate, because at the end of the day, that is going to help to preserve the life of their employees. What a lot of people might not be thinking about is exactly what employers are now going through. From my perspective as a physician, so often for various workplaces, we have folks who we are sending off on quarantine for 2 weeks at a time from these workplaces. And during these times, of course, these small businesses have to be paying these workers because they are off on sick leave. Not many businesses will be able to survive that, but at least if people were vaccinated in the workforce, then for one, the quarantine period that we would prescribe for people who have been exposed would have been much shorter and would therefore make it much more affordable for the business. But more importantly, the reason we're able to prescribe shorter quarantine times is because we are confident that the persons who are vaccinated are at much lower risk of ill health because of exposure to COVID. So someone who is vaccinated who would come to my office and tell me that they were exposed to someone briefly, I would not be worried about that person. But an unvaccinated person who has been exposed to that person just as briefly, I would be worried about that person, because we're not just necessarily thinking just about the workplace, but you think about the family that is at home with that worker. So it's not just about the workplace; it's about protecting the family at home. And from my perspective, from where we sit and what we see, there's a lot of suffering, guys. For those of us who are still around, you need to understand that many people have lost loved ones. They have lost the breadwinners for their homes. A lot of people are suffering as a result of this. And so this is not the time for us to get political about what needs to be done. But from a medical perspective, from a public health perspective, I can tell you that a vaccine mandate is required. So thank you guys for having me. It was a pleasure. And thank you, Dr. Robinson Madden. It was really a pleasure to be here, and I'm grateful for you allowing me this opportunity to add a voice to your Research Day presentation. Thank you. Have a good day now, guys.